Kidney patients. For vitamins that are quietly damaging your kidneys after 60. What if I told you that a small pill you take every morning could slowly be putting stress on your kidneys after 60? It sounds hard to believe, right? After all, vitamins are supposed to help us stay strong. Many people over 60 take them every single day to support bones, immunity, heart health, and energy. But here's something most people are not told. As we age, our kidneys naturally slow down. Even in healthy adults, kidney function gradually declines over time. Doctors measure this using a number called GFR, and that number usually gets lower with age. If someone already has kidney disease, diabetes, or high blood pressure, that decline can happen even faster. The kidneys are still working, but they are not as efficient as they once were. Now, here's where it gets serious. Some vitamins are not easily flushed out of the body. Instead of leaving through urine, they are stored in body fat and organs. When kidney function weakens, these vitamins, especially in supplement form and high doses, can slowly build up inside the body. And when that buildup happens, the risk of toxicity increases. Not suddenly, not in a dramatic way, but quietly over time. In today's video on Healthy Everytime, we're going to break down 4 common vitamins that may be adding hidden pressure to aging kidneys, especially after 60. Make sure you watch until the end because I'll also show you how to protect your kidneys while still getting the nutrients your body truly needs. Let's get started. Number 1, vitamin A. Let's talk about vitamin A in a more honest way. Most of us grew up hearing that vitamin A is good for our eyes. It helps us see at night. It helps our immune system fight infections. It even supports healthy skin. So, when people over 60 take it, they usually think, I'm doing something good for my body. And normally, that would be true. But here's the part that doesn't get talked about enough, especially for people with kidney problems. As we get older, our kidneys naturally slow down. They still work, but not as smoothly as before. If someone has chronic kidney disease, diabetes, or high blood pressure, that slowdown is even more noticeable. Now imagine this. Vitamin A in the body travels with special proteins in the blood. Healthy kidneys help clear out the extra amounts. But when kidney function is reduced, those proteins and the vitamin A attached to them are not removed as well. So what happens? It slowly builds up. And this isn't just theory. Medical research has shown that many patients with chronic kidney disease already have higher blood levels of retinol, the active form of vitamin A, even if they are not taking supplements. That means their bodies are holding on to more than they should. When vitamin A levels get too high, real problems can begin. One of the biggest risks is high calcium levels in the blood. Too much vitamin A can increase bone breakdown. When bone breaks down, calcium is released into the bloodstream. Over time, that extra calcium can increase the risk of kidney stones. It can also lead to calcium deposits inside kidney tissue, something doctors call nephrocalcinosis. In more serious cases, it may even contribute to acute kidney injury. For someone whose kidneys are already struggling, that extra stress can make things worse. There's also concern at the microscopic level. Studies suggest that long-term high intake of retinoids may irritate and damage the tiny filtering cells inside the kidneys. This can increase inflammation and oxidative stress, basically meaning the kidney tissue becomes more strained over time. Some research has also linked higher vitamin A levels in CKD patients with higher creatinine and lower estimated GFR, both signs that kidney function is declining. Now, let's be clear. The biggest risk usually comes from supplements, not food. High-dose vitamin A pills, cod liver oil, and certain anti-aging or skin supplements can contain large amounts of retinol. These doses can easily go beyond what the body actually needs. On the other hand, foods like carrots, sweet potatoes, and leafy greens contain beta-carotene. The body converts beta-carotene into vitamin A only when needed. That natural control system makes food sources much safer. So what should you do? Simple. Don't take standalone vitamin A supplements unless your doctor specifically tells you to. And never exceed the recommended daily amount without medical supervision. Vitamin A is not the enemy. But in aging kidneys, too much of a good thing can quietly become a problem. Number 2, vitamin E. Now, let's talk about vitamin E. You've probably seen it advertised as a powerful antioxidant. It's often promoted for heart health, healthy skin, and even slowing aging. Many supplements labeled heart support or anti-aging contain high doses of vitamin E. And yes, in normal amounts from food, vitamin E plays an important role. It helps protect cells from damage caused by free radicals. That sounds like a good thing, and it is. But here's where things can get complicated, especially after 60. When taken in very high doses, vitamin E may not always act like a protector. In fact, research has shown that megadoses, often over 400 IU per day, can sometimes have the opposite effect. Instead of reducing oxidative stress, they may increase it in certain tissues. That includes the kidneys. The kidneys are already under pressure in older adults, especially those with chronic kidney disease. They deal with constant blood flow, filtration, and waste removal. When oxidative balance is disrupted, kidney cells may experience more stress instead of less. There's another issue many people don't realize. Vitamin E can affect blood clotting. It reduces platelet aggregation, which means it makes the blood less likely to clot. For some people, this may sound helpful, but for older adults, especially those taking blood thinners like warfarin or other anticoagulants, this can increase the risk of bleeding. Internal bleeding, even if mild, can reduce blood flow to the kidneys. And when the kidneys don't receive enough blood supply, it can lead to what doctors call reduced kidney perfusion. Over time, that may contribute to secondary kidney injury. In simple terms, too much vitamin E can make a delicate system even more unstable. There's also a broader concern. Some large medical reviews and meta-analyses have suggested that high-dose vitamin E supplementation may be linked to a slight increase in overall mortality risk. While the exact reason is still debated, it raises concerns that very high doses may place unexpected stress on the body. For people with chronic kidney disease, this matters even more. CKD is already linked to chronic low-grade inflammation and oxidative imbalance. The body is trying to maintain stability. Adding high-dose antioxidants in supplement form may sometimes disrupt that balance instead of improving it. Now, let's be clear again. The biggest risk comes from high-dose supplements, not food. Vitamin E from natural food sources like almonds, sunflower seeds, and small amount of plant oils is generally safe. These foods provide moderate levels that the body can handle properly. The danger usually appears with long-term use of high-dose heart health or anti-aging capsules taken daily for years. So, what's the practical advice? If you're over 60 and have kidney problems, avoid high-dose vitamin E supplements, especially anything over 200 to 400 IU per day, unless your doctor specifically recommends it. And if you are taking blood thinners, always speak with your physician before adding vitamin E. Just because something is labeled antioxidant doesn't mean more is better. For aging kidneys, balance matters far more than megadoses. Before we continue, if this video is helping you understand your kidneys a little better, take 1 second to subscribe to Healthy Everytime. We post simple, clear kidney health videos every week, especially for adults over 60. And I'd love to hear from you. How old are you, and where are you watching from? Drop it in the comments below. If you have any questions or health concerns about your kidneys, write them down there too. I read your comments, and your question might help someone else as well. All right, let's keep going. Number 3, vitamin D. Now, we need to talk about vitamin D. This one is very important, and it can be confusing. Vitamin D is essential for bone health, immune function, and muscle strength. Doctors often check it in older adults because low levels are common. Many people over 60 are told they are deficient, and they start taking supplements right away. So far, that sounds reasonable, but here's the serious part. Vitamin D is one of the most commonly overdosed fat-soluble vitamins, and when taken excessive amounts, it is also one most clearly linked to kidney injury. The main problem is calcium. Vitamin D increases how much calcium your intestines absorb from food. In normal amounts, this is helpful for strong bones. But when vitamin D levels get too high, calcium absorption can become excessive. That leads to hypercalcemia, high calcium levels in the blood. And high calcium is not harmless. Too much calcium can form kidney stones. It can also cause calcium crystals to deposit inside the tiny kidney tubules. Over time, this can lead to nephrocalcinosis, which means calcium buildup inside kidney tissue itself. In more severe cases, high calcium levels can trigger acute kidney injury. The kidneys become inflamed and stressed because they are trying to clear excess calcium from the blood. But it doesn't stop there. In patients with chronic kidney disease, calcium balance is already delicate. CKD affects phosphate levels and parathyroid hormone PTH. When large doses of vitamin D are added without careful monitoring, it can worsen calcium phosphate imbalance. This may accelerate vascular calcification, meaning calcium starts depositing in blood vessels, including those that supply the kidneys. When blood vessels stiffen or narrow, kidney perfusion decreases. Less blood flow means less oxygen and more long-term damage. There's also another effect many people don't expect. High calcium levels can cause frequent urination called polyuria. This can lead to dehydration. When the body becomes dehydrated, kidney blood flow drops. For aging kidneys, especially in people over 60, dehydration alone can trigger sudden declines in kidney function. And yes, there are documented medical cases where long-term vitamin D toxicity, called hypervitaminosis D, has led to chronic kidney damage. Some severe cases require temporary or even long-term dialysis. Now, how does this usually happen? Often, it starts with good intentions. Someone is told they have mild vitamin D deficiency. They begin taking 5,000 to 10,000 IU daily. Sometimes they combine multiple supplements, a multivitamin, a bone formula, maybe a calcium supplement that also contains vitamin D. Without realizing it, the total daily intake becomes very high. Months pass, blood levels are not checked, calcium slowly rises, and the kidneys quietly carry the burden. So what is a safe approach? First, always check your 25-hydroxy vitamin D blood level before starting supplementation. That test shows your true vitamin D status. Second, avoid exceeding 4,000 IU per day unless your doctor is supervising you closely. For many older adults, much lower doses are enough. And for people with chronic kidney disease, dosing must be individualized. Doctors usually monitor calcium, phosphate, and parathyroid hormone levels before adjusting vitamin D. It is not something to guess. Vitamin D is not the enemy. In the right amount, it is necessary, but when overused, especially after 60, it can quietly become one of the most kidney-damaging vitamins of all. Number 4, vitamin K. Now, let's talk about vitamin K. Compared to the other vitamins we discussed, vitamin K is not usually seen as dangerous. True toxicity is rare. Most people don't overdose on it the way they sometimes do with vitamin D or A. But if you are over 60 and living with kidney disease, vitamin K still deserves attention. Not because it is highly toxic, but because it affects systems that are already fragile in kidney patients. The first and most important concern is blood thinning medication. Vitamin K plays a major role in blood clotting. In fact, it is directly connected to how your blood forms clots. People who take warfarin, a common anticoagulant, are often told to keep their vitamin K intake stable. That's because warfarin works by blocking vitamin K activity. If vitamin K intake suddenly increases or decreases, INR levels can swing out of range. When INR is too low, the blood clots too easily. When it's too high, bleeding risk increases. For kidney patients, both situations are dangerous. A clot can block blood vessels and reduce kidney blood flow. On the other hand, internal bleeding can also lower blood pressure and decrease kidney perfusion. Either way, unstable clotting can indirectly harm kidney function. This is why sudden changes like starting a high-dose vitamin K supplement can create problems, especially in older adults already taking anticoagulants. There's another layer to consider. Vitamin K helps activate proteins that regulate calcium placement in the body. Some of these proteins help move calcium into bones and away from blood vessels. That sounds beneficial, and in many cases it is. But in chronic kidney disease, calcium and phosphate balance is already disturbed. CKD affects parathyroid hormone, vitamin D metabolism, and mineral regulation. When high-dose vitamin K supplements are added without supervision, the effects on vascular calcification pathways may not always be predictable. In simple words, the mineral system in CKD patients is complex. Adding large amounts of any fat-soluble vitamin into that system should be done carefully. not casually. There's also a specific concern about synthetic forms of vitamin K. One form called menadione, vitamin K3, which is synthetic, has been linked in medical literature to oxidative stress and hemolytic reactions in certain vulnerable populations. While it is not commonly used in standard over-the-counter supplements today, it can still appear in some formulations. For aging kidneys that are already under pressure, avoiding unnecessary oxidative stress is important. Now, let's be practical. Vitamin K from foods such as leafy green vegetables is generally safe when eaten consistently. The key word here is consistent. For people taking warfarin, doctors usually recommend maintaining a steady intake instead of avoiding vitamin K completely. The problem usually appears with sudden changes or high-dose supplementation. So the advice is simple. Do not start high-dose vitamin K supplements unless your doctor specifically recommends them. If you are on warfarin or another blood thinner, never change your vitamin K intake suddenly without medical guidance, and avoid synthetic vitamin K products unless prescribed. Vitamin K is not the most dangerous vitamin on this list, but in kidney patients over 60, even indirect effects can matter. When your kidneys are already working harder than they should, stability is more important than experimenting with extra supplements. As we've seen today, not all vitamins are harmless, especially after 60. Vitamin A can slowly build up when kidney function declines. Vitamin E in high doses may increase stress instead of reducing it. Vitamin D, when overused, can raise calcium to dangerous levels and directly injure the kidneys. And even vitamin K, while usually safe, can create serious problems if not managed carefully, especially for those on blood thinners. The big lesson here is simple. More is not better. After 60, your kidneys are more sensitive. If you are living with chronic kidney disease, diabetes, or high blood pressure, your body does not handle excess the same way it did at 30 or 40. Supplements that seem small and harmless can quietly create long-term damage when taken in high doses without monitoring. This doesn't mean you should fear vitamins. It means you should use them wisely, with testing, with guidance, and with balance. If this video gave you new insight, make sure to subscribe to Healthy Everytime so you don't miss our next kidney health guide. Share this video with a friend or family member over 60. It might protect their kidneys too. And before you go, tell me in the comments, are you currently taking any daily supplements? Let's talk about it. Take care of your kidneys. They've been taking care of you for a lifetime.